Welcome to American Medicine Today. I'm Kimberly Bonati alongside Ethan Youker. We have a lot to cover. Let's get right to it. Today's progressive culture has been trying to redefine what it is to be a man and wrongly labeling strength as toxic, leaving many males feeling lost or ashamed of their natural instincts. Who better to discuss the topic than son of Hercules Braeden Sorbo, actor and author of Embrace Masculinity, lifting men up in a world that keeps pushing them down. Welcome to the show, Braeden.
Hi, thanks. Glad to be here.
Why don't you give us your take on this whole toxic masculinity and what made you want to write the book?
Well, the thing that made me want to write the book was an unfortunate need. I'm 23 years old, and I, growing up, had always wished that there was something that I could relate to. I mean, we have people like Jordan Peterson and, all those guys, the psychologists, and then the opposite, the manly men, who are all trying to help young men be better. The problem is I can't relate to them. They're married with kids. They didn't have the same struggles that I currently have growing up. And so I wished that there was someone my age who maybe had experienced similar struggles, or who could at least relate to me without making it seem like they were talking down as if they were better than me, and come from a place of humility. And so I decided to write the book for that very purpose. I saw that there was a need for young men to be able to kind of grow into the men that they're supposed to be. And so the book itself is, I call it a handbook for godly masculinity. It's a guide, if you will, when you come down to navigating every facet of life, whether that be dating and relationships, social media and pornography, the pharmaceutical industry, health and fitness, mental health, which is a big problem in America today. I mean, the suicide rates between men and women are around equal, whereas women have always typically struggled with depression more than men. And so there's an epidemic going on of young men not feeling wanted, not feeling welcome, and they just essentially, because they're being told that they're useless, they're taking it literally, and it's having a disastrous effect.
I can't imagine growing up now. I'm 45. You Braeden just said you're 23, so I mean, technically you could be the age of my son. I came of age late 80s and throughout the 90s and whatnot, and there wasn't much of that at all. And then all of a sudden, when do you think it started, I guess, is my question, if you've done your research, because it was probably right around when you were a child. But when did we turn the corner from men were allowed to be men? You didn't want some super aggro meathead guy. Nobody does. But it was okay to be a man, right? When did it become toxic, I guess?
Yeah, it became toxic very quickly in a very short period of time, but it was always this gradual kind of procession of making our way up the hill. We reached the pinnacle in about the early 2000s, and then it was a straight downward slope after that. I mean, we saw it big time with the sexual revolution and the consequences that had, along with the passing of Roe v. Wade in 1972, where the consequences of free sex, which was, having a baby, was no longer necessary, valid, or even something people were concerned about, because they could just go and get an abortion. And so it destroyed the family unit and the system men are ingrained to build up and protect. I mean, as a man, my value comes from finding a wife and having kids who both love and respect me. And if I don't find that, if I can't find people who respect me or value the contributions that I am making and the sacrifices that I'm making for the betterment of their good, then my sacrifices are in vain and I'm going to stop making them, which is what we're having today. Plenty of men who are seeing themselves as worthless or irrelevant or useless, more so than the comedic sitcoms in the 90s and the 80s, where the dads were just kind of these bumbling fools, these clumsy buffoons, that kind of thing. Men are feeling worth less than that. And so it's kind of this generation, I like to call them the Peter Pan Neverland lost boys. They're over on the island refusing to grow up. And there's a reason for that. It's because society told them they didn't have to. Men had to grow up because you weren't going to find a wife if you didn't grow up. And a woman wasn't going to marry you if you didn't have any value. If you weren't able to protect and provide for her, then she had no reason sticking around. And so men had to build up this inherent value so that they would become worthy of a good wife. And when all of that criteria went out the drain, it sort of became irrelevant. And so guys don't even have to try anymore. You could download Tinder and have someone come over to your house to Netflix and chill. You don't even have to buy a ring, let alone make a commitment of any kind.
We're going to take a quick break. We'll be right back with Braeden Sorbo after this. You are watching American Medicine Today.
Don't be screwed by lesser spine institutes who bait you with minimally invasive procedures, then switch to screws, rods, disc replacements, and hardware. At Bonati, no metal hardware fusions are ever used. Bonati invented the precise tools necessary to minimize surgery, scarring, anesthesia, and recovery. So successful are the Bonati Spine procedures, they consistently reflect 98.75% patient satisfaction. Over half our patients have suffered from failed back and neck surgeries at other facilities. Bonati succeeds where others fail.
Welcome back to American Medicine. Today we're continuing the discussion about toxic masculinity with Braeden Sorbo. As a female, I love to feel protected. It's not that I feel like I couldn't protect myself, but you want to feel feminine and have a guy that you can rely on and open doors. How did this suddenly turn into something that's anti-female and something the feminists want? I like the niceties. I like the chivalry.
It's like ultra feminism now, you know. I mean, and not to jump off of Kimberly's question there. Have you been noticing recently? There's almost like a fad, if you will, where women are coming out and saying, I don't need a man. I don't need to have children. No, you probably don't. You know, there's nothing wrong with being that way, but don't downplay me as a man, specifically a white male, because it's been crammed down my throat for the past 10, 15 years that nobody cares. You're a white man. You're worthless. You're a dime a dozen. People are tired of white men. I don't get it. And I don't know who actually thinks that way. What's your take?
It's unfortunate because a lot more people would think that way than we would initially perceive. And the feminist waves, the movement itself, has always had the end goal of destroying both men and women. The most recent waves being, that women are better than men, and now that men are women and can beat them in their own sports. And so we've had this kind of like I said, it's a gradual decline and degradation of society. Did you know in the earliest waves of feminism, when this whole the 19th Amendment was passed, only 4% of women wanted it, because by and large they recognized that it wasn't this divide. The government was purposefully trying to convince people, oh, you're not valuable unless you go get a corporate job, or unless you have this right, or unless you have this. They tricked people into thinking that they weren't unified. The reason why only 4% of people actually wanted this when it was passed was because they recognized that the household voted as a singular unit. It wasn't this, I'm better than you and you're worse than me and I have control and you're my subservient, worthless little whatever. It was, I take responsibility for you. I care for you. And that means that with this vote, I use it to ensure the protection and safety and kind of this insurance in our entire household. I use it to recognize and become responsible for more than just myself. And when we destroyed that, we allowed people to vote selfishly. We allowed them to slowly, ironically, go for their own demise. And it's why we have the biggest divide we've ever had politically in my generation. I mean, more young men voted red in 2024 than young men have ever voted before, but more young women voted blue. It's the largest divide historically that we've seen. And there's a reason for that. It's because of this idea of unity has been thrown into the trash. We've disregarded what it means to have cohesion in society, and we're seeing it play out right in front of our eyes.
Your father wrote the foreword of the book. Can you tell us exactly what he said?
I can't. I don't have it memorized, but I can paraphrase for you. He gave a little bit of a backstory of his life and also laments the fact that I even had to write this, which I do as well. I wish, like I said at the beginning of the interview, that I didn't need to do this. But here we are in today's day and age where this is unfortunately very necessary. And so I was blessed when I asked my dad to do it. It was probably the best play I could have done in terms of asking people. I mean, who better to write the foreword on a book on masculinity than the father of the author? I thought it would be perfect, whether or not he was Hercules.
What do you want the biggest takeaways to be for readers of Embrace Masculinity?
The biggest takeaways for readers of Embrace Masculinity is to know that hope is not lost. That is, so many people are what's called black pilling, where they just doom and gloom. It's so over. Everything is gone. We're done for. We're destroyed as a society. We are not. We can come back from this. It's going to take work. Young men are going to have to buckle up and put on their boots and get to work. And that's just how it is. And the young women are going to have to do the same thing. And so if you want a good way to get started on that, I'm going to plug the book at sorbostudios.com. They can get a signed copy from yours truly. And that's about it. That's all I got.
Thank you so much, Braeden Sorbo, actor and author of Embrace Masculinity, Lifting Men Up in a World That Pushes Them Down. Thank you for talking about such an important story and how we need to embrace masculinity.
Thanks, Braeden.
Thank you.
Take great care. Well, that's all the time we have for this segment. Make sure you stay tuned. We'll be back after the break. You are watching American Medicine Today.
My name is Brian Mullen. I'm from Palm Coast, Florida. I am a home builder, and I'm a swimming pool contractor, a roofing contractor. I recognized I was starting to have a problem, get a little pain, and then it got worse and worse, and to the point where I could barely get up out of bed. Very, very painful. It started right there in the base of my back. I'll say my tailbone, way down in there. And that's what the pain. And then it started to increase a little bit down into my butt, and then that was very heavy tightness. So then it started going down my legs a little bit in the back, some more tightness, no real zingers, but it was there. It was almost like a rubber band. I'm just like stretched too far. Prevented me from getting into the back of my pickup truck. We have a step back there, and I'll forget that. Reaching over the side, picking up anything, forget it. And certainly my activities after work, boating, can't get up, down, around, turn, that's out. Going to the beach and walking down the beach, just regular activities that one would expect to be able to do at my age. And that was the point where I know I needed some help.
Brian tried conservative treatments to relieve his pain.
I take the Tylenol. I just tried to get my feet up and try to sit in the right position after work. I went to a chiropractor about a year ago. I went to my general practitioner. More recently, I saw a doctor, and he was doing injections into my L5, L4 area. I got 3 injections. The first one worked okay. And then the second one, not so much. And the third one was a disaster, extreme pain.
Brian and his wife learned about the Bonati Spine Institute while watching TV. He started researching more about the exclusive Bonati Spine Procedures.
We came in and got a examination.
Brian required 3 procedures to relieve his pain. At the Bonati Spine Institute, surgeries are performed incrementally using conscious IV sedation, where the patient remains awake and communicating with their surgeon to determine the source of their pain is eliminated while they are still on the operating table.
That was nice. It was better than I thought it would be. I didn't know what to think. How are you doing? I was talking to my anesthesiologist. She was encouraging me along the way. She was speaking to me. First day I got some relief, and then the second day was the big one, and I got some major relief. And the third day it was even more, it seemed, than the second day. It's done. I'm so glad that I followed through. And I got all 3 of them done at the same time. I got to tell you, after the third operation, and then now today, I have improved tremendously. After surgery, I was, because it was from the back and not from the front surgery, there was no extreme trauma to any organs or anything like that. So I didn't need any physical therapy right there. I didn't need a wheelchair. I didn't need large bandages or wrappings of that sort. I mean, who wants to go into a hospital where you never get to sleep, right? They're always in there poking you every 15 minutes, and you're not getting any rest in any hospital, that's for sure. So by having the hotel that we had down the street, it was very convenient for us to just back and forth it. Couldn't imagine anything better. Really, it was quite convenient.
After the Bonati Spine Procedures, patients are prescribed walking therapy, about 40 minutes a day to aid their body in the healing process.
Just walking a little bit, just getting around and walking maybe 5 minutes here, 5 minutes there. Just keep everything moving.
Brian highly recommends the Bonati Spine Institute to anyone suffering with neck or back pain.
This place is fantastic. I tell them only to come to Dr. Bonati and his team.
Now pain-free, Brian is looking forward to returning to work and his daily routine.
I'm looking forward to get back to my regular routine, and I'm fortunate enough to be still young enough, to be able to do all that. And I'm ready.
To see more stories of recovery just like this, search for the Bonati Spine Institute on YouTube, Rumble, Apple's App Store, Google's Play Store, Roku, and Amazon's Fire TV.
Welcome to American Medicine Today. I'm Kimberly Bonati alongside Dr. Bonati, who would like to discuss the risks associated with surgical site infection.
Well, spine surgery is a very common surgery. The problem is there are different types of procedures, or different types of techniques, that some of those ones create different types of complications or problems. Infections in procedures like the one that we do at the Institute, that we use an arthroscope to treat the patients with it, this procedure carry a possible level of infection of 0.5. The infections on the spine after surgery can be two types. One is a superficial type of infection, and the other one is a deep type of infection. The superficial infections are not very bad to treat if you are immediately alert to some type of a problem on the wound, and the patient show you the wound is in a certain way, looks a little bit abnormal, then cleaning that wound and treating that wound must be done. If you do that, you are going to avoid that this infection can trickle down and create a deep infection. A deep infection is extremely dangerous because not only is go directly to the canal that you already opened, it's a free communication from the skin that is contaminated to the areas that you operate. And that is practically associated with a structure like muscle, fascia, fatty tissue. All these elements are areas that the infection can grow very easy. Sometimes the infection can get on the bones, and then you develop osteomyelitis. That is an incredible bad type of a problem that takes a long time to treat. Other times, if the deep infection may go to the disc and create discitis. The discitis is an inflammatory process that happens on the disc. And sometimes this discitis is so incredible aggressive, depending on the microorganism that is responsible for the infection. If it is a staphylococcus, it's incredible aggressive. Usually will destroy the bone. So not only the disc will be affected, but now will be also destruction of bone present. And you can see that in the MRI, you can see that in the X-ray. The way that you need to understand these infections is practically a very clear understanding of the patient health before you touch the patient. If the patient is a diabetic, you need to be careful and you need to prevent any type of exposure. You need to see what illnesses is affecting the area. For example, patients that they are in anticoagulants, then you do the surgery and you have a massive bleeding in that area. And if you have a massive bleeding, that clot needs to be treated as soon as possible, because not only is going to create pain, can compromise also the neurological structure, but the important thing is that it can be a seeding step for any microorganism. So you have a massive abscess. Those things, they need to be considered, you need to look at, and you need to be very conscientious how you treat the superficial infection, how you treat the deep infection. And the deep infection usually is associated with some type of exposure of microorganisms that they are on the skin. Usually the people have the surgery and they lie down in bed, they have pain, they sleep on the wound. If the wound is not properly clean and is not observed all the time, that infection can immediately affect the area, and then you can have a situation that can be superficial initially, deep later. You need to remember that the possibilities of infection with this procedure that we have at the Institute are not only minimal, almost non-existent. And they are because while we are doing the surgery through the whole procedure, after we introduce the tube and put the instruments to work, we need to clean the scope. And cleaning the scope means that the lens, they need to be totally clean so you can see what are you doing on the inside. To do that, you need to have fluid. So we use normal saline and then with antibiotics. So the area is totally surrounded and treated with antibiotics through the whole time of the procedure. So the possibilities of bugs growing in that area are practically none.
So the risk assessment for surgical site infection is highly reduced due to the constant irrigation of antibiotics in the surgical site area with your patented Bonati Spine Procedures. Well, that's all the time we have for this episode of American Medicine Today. To catch previous episodes, make sure you download American Medicine Today to your favorite streaming device.
If you have any comments or questions, contact us at the numbers below. Or you can tweet at Dr. Bonati using the hashtag American Medicine Today or hashtag AMT. We would like to hear from you.